ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. All right, welcome back to another episode of Beyond Graduation. I'm Savanah Craig, and with me as always,
I'm Ronnetta Sartor.
Welcome back, everybody. So today we're going to start with a very, light and easy topic of mental health. Reneta, what comes to your mind when you think of mental health, or inside of dentistry, outside of dentistry? What does that bring up for you?
It's a loaded topic.
Yeah, on the spot.
Yeah, it's definitely a loaded topic. I think the first thing that comes to mind, and everyone's talking about it lately in dentistry, is burnout.
Yeah.
And what that means. And I think it's all encompassing because we have our life as it pertains to our career, but our everyday life too, both go hand in hand. And so making sure that we find balance, if there's a such thing, is very important.
Yeah.
What does it bring up for you?
Yeah, I think it's definitely a journey. And right now in my life, I think of it more as like a practice, like a yoga practice, dental practice. Like this theme keeps coming up about, it's never going to be perfect, and just trying to meet yourself where you are at this moment. But that's where I'm at for me. But I think stepping away from like our personal experience, dentistry as a whole has, whether people know it or not, if you're in dentistry, I think you definitely know it. But dentistry has I don't want to say a bad reputation with mental health, but we as a profession seemingly struggle a lot with mental health. We have statistically one of the worst mental health. What are your thoughts on why that is in dentistry? And do you think, I think the struggle with mental health is different generationally in dentistry?
100%. I think so.
Yeah.
I think the newer generations where it's less stigma around like getting help. And I mean, you hear online all the time people talking about going to therapy or like having groups of people that they talk to. And that maybe was not such a cool thing to do with some of the older generations or more seasoned dentists.
Yep.
But I also think as things change and we become a world where, reviews are really important, and what people say and think about us can really, really impact our reputation. And so it's harder living in this digital age to like get away from some of the noise sometimes.
That's a really profound point.
Because I mean, I don't know, I maybe would have loved to do dentistry like before the .com era and before, we had to worry about reviews and people just wrote their appointments down in their their planners, and we didn't have to worry about software to like text and remind patients about their appointments.
We were just having this talk with one of my colleagues about like, there wasn't Google, so people just believed you when you were like, this hurts, this is the solution. And they were like, cool, great, do it.
Right. And I mean, even think about the way that we process radiographs and stuff.
Yeah.
It was, you came in, you got the radiograph taken. It wasn't like digital. It didn't just pop up as soon. You had to go and process it. While you processed it, the patient and the dentist talked about, how they're doing, what's going on in their life and that sort of thing. So,
and you didn't have AI to prove that it's a cavity.
That's true.
Yeah.
That's true.
Very different things. I do think, at least in my experience, which maybe is not everyone's experience, but I feel like I have made a point to be connected to my colleagues and friends like you. And so that makes, just like why we started this podcast, that makes me feel less alone. And that might be different than the older generation who was more likely a solo practitioner kind of on an island.
And so I think for sure now there are a lot more group practices in dentistry,
yeah.
which is before, like you said, it was just solo practitioners mainly.
Yeah. So my theory, which we kind of got into in the beginning of one piece of, I think, why dentists' mental health is difficult. I don't know. I mean, like, obviously everyone has their things, different, jobs have different things, right? I'm not saying like ER physicians don't have it worse than we do. But I do think there's some nuances with like us balancing this like small business mentality and also being a healthcare provider and all of these different hats we wear. But my experience is that like part of the dental mental health issue is we're like bred to be very competitive with each other. And I think part of that is from dental school, where the only people understanding the experience you're going through are your classmates, and yet you're ranked against them for tests and exams and all of these things. And I saw like my friend group and I were very intentional about separating us as students and classmates from our friendship. And I don't know that many people did that. And so then when you get out, people are still like, what do you produce? What's your collections? How many CE hours have you taken? And you're like, I don't know, man. I'm just going to work to pay my bills. And so I think if you don't make an intentional point to not build this scarcity mindset and this competition, like, it will destroy you. But I know that you have a different thought on why dentists are how we are.
So I think it's different but similar, right? So I'm in 100% agreement with you in terms of we have to be the CEO, the COO, the CFO, all of the C's,
and
due to dentistry, the dentistry. So that takes a toll on anybody, right?
For sure.
But just kind of going back to how most dentist personalities are. We've always had to strive for something. So there's always that, okay, what's next?
Totally.
You graduate dental school, then you're like, okay, I have to go to college. I have to make all A's or have a really competitive GPA.
Yeah.
Then I had to take the DAT and I had to be competitive in that too. Got to get into dental school. Have to get, if I want to do a residency, I have to do really well.
Yep.
I think the system is kind of designed for us to compare ourselves to other. And for me, it's not so much that it's a competitive, like me against someone else type thing. Mm-hmm. I think the comparison creates a me versus me mindset that sometimes is the worst thing for me. Like, I'm not the type that will compare myself or compete with like other dentists, if that makes sense.
No, 100%.
But I think the worst version of myself is when I get in this mindset that I've got to be better than I was yesterday.
Yeah.
When sometimes, all I have today is all I have today to give.
Yeah.
And that's it. So
progress isn't linear.
Right. It's ups and downs and ebbs and flows. And I think more than anything, I think it's more so we're set up for comparison because you learn how to do the dentistry with everyone. So you're looking at their crown preps and everything. And then sometimes it creates am I worthy? Am I enough mindset within ourselves? And so that's my perspective. Not so much like competition, but like the comparison and then how it can take a toll on us.
No, I think we're talking about two sides of the same coin, and we're taught to focus on millimeters and microns, 12-degree taper versus 8-degree taper, and like your brain is not meant to do that. So, and then you get out in the real world and you're like, there's a big old hole in this tooth. I don't know.
Yeah. It's funny. So right now in our office has a college student that's shadowing that is actually applying to dental school. And it was so funny. I know. It was so funny. So She come in and it was like polar opposites in terms of patients that were in each room.
Nice.
And so in hygiene, we had a patient that's like, you telling me you want to rip all my teeth out and I don't trust dentists and you guys are crooks and this and that. He's just like reading us from top to bottom. And then we're in the next room and it's this sweet old lady that's like, okay, whatever you say, doc. And then we're going in the next room and this patient is terrified of the dentist because of past experiences that she had. So with the ebbs and flows of like the business side of dentistry, you also have the ebbs and flows that you have to make sure that when you come in a room, you're everything that patient needs for you in that moment.
In real time.
And I was, jokingly talking to her. I'm like, dental school does a magnificent job of teaching you how to do the clinical stuff. I said, but it's the patient management stuff that sometimes can take a toll too.
Totally.
And it's like, because you kind of on that emotional roller coaster too.
Yes.
You're having to calm the patient down that's saying that you're a crook and and they just don't trust dentists in general.
Yes.
But
and the calm you need to give that patient versus the anxious, scared patient is so different. At least in my world, like there's a different calm confidence you need to have, but it's similar, but like the way you have to it's like the disc thing.
Yeah, so
do you ever feel like you're playing a character in different rooms?
Sort of, but not exactly. It's almost like I've read like so many books that about dentistry that say things like, from the start of the day it's showtime, right?
Yes.
And what I think is pretty much, when we were kids, we're like, treat people how you want to be treated. But we learned that we need to treat people how they, want to be treated. And in that pretty much is ebb and flow of navigating it and being able to give the patient what they need, because every patient is different, in terms of their needs. And so, it's a journey of from the time you walk in the room, just navigating it. So I don't necessarily think that it's a character. I think it builds character. and I think it builds character to be able to navigate, what do you think? What's your take on it?
Some days I do feel like I'm playing a role. I mean, I think it's me on obviously, but different versions of me for who they need me to be. But I think obviously the more you do this, the more you realize like, okay, this patient isn't mean. They're actually really scared, and the way that they are approaching it is different versus, like we just said, the like terrified and like being in that patient needs me to come in as calm and like understanding and reach them where they are versus not combative isn't the right word, but like they're more like
the patient that pretty much said that we're crooks and stuff.
Yes. They're also terrified of us and they don't trust us.
Right.
But we have to come into that room with a steady confidence. Because if you, and again, like babying them isn't the right word, but like if you come in and you're like, I know that you're scared, blah, 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 like they're going to eat you alive. So yeah, that's a big piece, I think, of dental mental health. And like, I'm very empathic. And so I take that energy into myself. And so I almost have to like shuck it when I leave the room of like, okay, whatever was in there, I got to put there and I got to go to the next place. And I think if you don't have a good outlet to get that out of your mind and out of your body, it's really going to tear you up.
So what advice would you have for a new dentist or anybody that's struggling to try to separate the two?
Yeah. I think the biggest thing is it's absolutely okay to ask for help. A mental health professional, a therapist, medication, like really truly finding what is right for you and knowing that it's okay. And a lot of us are in therapy and doing things we need to take care of ourselves so we can take care of other people. And then like find an awesome group of friends and mentors like who aren't going to compete with you, who aren't going to judge you, that you can be like, listen to this day I just had. Like, I don't know, sometimes and again, like you said, every day I'm a different person, and some days things like that can roll off my back and some days they can't, and giving myself some grace with that. But also like, I know that I can call you and be like, listen to this situation. And like, I don't know, sometimes I let my patients gaslight me a little bit of like, am I the problem? Like, especially dentistry comes in waves, and I feel like you'll have a week where like everyone is chill and everything goes great. And then you'll have a week where like everyone is mad at you and everything goes bad. And you're like, am I the problem? Like, I'm the only common denominator here. Do you know what I mean?
100%.
So find your people. And I don't know, I think Reneta and I are totally down to be your people. We've been interviewing some potential new associates for the office, and they've been so shocked at like how well we all get along in a group practice, which can be hard. Dentists, people in general are strange. Dentists, we're weird. And so finding like, you know, a bunch of dentists that get along and don't belittle each other or steal each other's cases and things like that is really, really special. And so it's been really cool to see these people be like, you guys are really like nice to each other and have each other's backs. And so find that group. And if you don't have that, like, please reach out to us, DM us on Instagram. I'm happy to be your sounding board. And trust me, in my very short career, I've had the experience. I don't know why, but it's me. They find me.
Maybe it's so that you could be a mentor to other people.
Yeah, that's what we'll go with.
Yeah.
What about you? How do you handle this? And has it changed over your journey as from associate to practice owner? Because you've got obviously way more hats now.
I think I've definitely developed a tougher skin.
Yeah.
But it also doesn't mean that like I come off like really crazy to like the patient that like say you guys are crooks and this and that. In that case, pretty much I know him well enough to know that I can like press him back on certain things.
And some people like that.
Yeah, and he liked it. So I was like, okay, well, when have I ever told you anything that wasn't true? Like, if we look at these x-rays together, if we look at the intraoral photos together, we've been talking about these things. All I'm doing is telling you the consequences of not moving forward with treatment.
Your mouth, your choice.
And then you know what he said next? And he said, well, I'll come and get it done if you could do it Monday or Tuesday morning. And I said, okay, we'll make that work.
Yeah.
Yeah. I think you just kind of learn, you know, like just from talking to patients and communicating what their communication style is and, you know, how you have to present things. And I'm not saying that to say that every patient interaction is easy, because some of them aren't. And sometimes you have to, you know, dismiss patients who don't align or don't trust you so that they can find someone that they do trust.
Yeah.
But I think over time that helps. Kind of getting back to what we were saying about what things that I do for myself is I give myself a 10-minute maximum after work. If it's something I need to talk about that happened at work, 10 minutes is all I have, and then I have to let it go to decompress for the day. And then, you know, having an outlet, like you said, whether it be working out, whether it be, you know, getting in your massage chair that you have or getting in the sauna or, you know, talking to someone, even if it's like your significant other or best friend or, you know, someone that knows you or watching TV, whatever it is you need to do to feed you is important. And then always going back to why you became a dentist and what your why is. That helps me out all the time on my toughest days.
Yeah. I think that's such a good point about you gotta just let it go. And that's so much easier said than done. But you did your best in that. Like, even the thing that I'm trying to get through to myself even is like, even if it wasn't the best I have ever done, it truly was the best I could do in that moment, in that situation, and letting that be enough. And and also just like not taking it on yourself. Like, I didn't put the cavity there. I did my best I could to your problem, and that has to be enough. And if it's not, I'll get you in the hands of somebody who can do it, or let it be good enough. Yeah. I think the biggest thing is know that you're not doing this alone, and finding your people to support you through it on your good days and on your bad days. Because I also think we don't celebrate the good things enough either.
Yeah, and I think I want to piggyback on something you said earlier about giving yourself grace.
Yeah.
And like, I think I was telling you about a month ago, I was like, man, I have these goals and the year's been weird and I don't know if I'm going to make the goal. And, you know, I was talking to a friend and pretty much they were like, well, who said that you, like, who created that goal?
Yeah.
Like, you know, I did. Okay. Yeah. So like, and then they brought up valid points, right? Like, what are the things you could do that would get you to that goal? And I started naming stuff, and then I'm like, okay. And they're like, well, why don't you do it? And I'm like, well, I don't want to because I want to do it. You know, like,
no, yeah.
I want to reach that goal, but on these terms that I have set for myself. So
and not compromising your values in other areas.
And so if that means that the goal happens a little bit later, but you're able to do it to where you can sleep at night and you stay true to who you are and your values, then sometimes that's enough.
Yeah, that's huge. And also, like, calendar years are fake too. You know what I mean? Like, what's 3 or 6 more months? Like, yeah.
That's true. I was but I was listening to Mariah Carey talk about how time doesn't exist. And I was like, man, I wish I could be that place.
Yeah.
Yeah, I wish I could get there mentally. But I imagine it's a great place to be. If you're just like, yeah, it doesn't matter.
I say that all the time. It truly doesn't matter. Like in the best ways, not in an apathy way, but in like it'll get there when it gets there. But I think that's a huge point of when you have these things that you want to do and you could do it, but it would compromise your values. Maybe you need to like pivot that plan and be a little more flexible.
Go back to your why. That's what I had to do. Like, I had to go back to it and say, okay, I'm not willing to do the things that would go against my why to get to a goal, you know?
Yeah. Wow. That is a place of growth to be able to think that way. Yeah. And I think flexibility is huge in mental health in general, of just like, you are a human. And some of these, like time as a construct, production goals as a construct, like life is just gonna life. And you sometimes just have to like let it go and let it be what it's gonna be. Easier said than done. This was a big one. I am so interested to hear what people's perspective is on mental health. Obviously, this is a huge topic that we could talk about forever, and we'll probably circle back to it. But please reach out if we could be of any help or support you as you do the tough thing of being a dentist. All right, we'll catch you next time.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr_Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.